In this lecture, I'm going to go over the athletic healthcare team for Chapter 1 in our book. So the objectives for our lecture is: what is an athletic healthcare team? What role or roles might you play on this team? And responsibilities of the different members of the athletic healthcare team. So the athletic healthcare team is made up of all the people responsible for the healthcare of athletes. And we'll talk about what each member could be. It requires a group effort to be the most effective to provide the best health care. And each member of the team must perform specific jobs or responsibilities for caring for an injured athlete. So you might have heard of the term sports medicine before. That is a general term that encompasses a bunch of different areas within taking care of an athlete, and their care can be involved in the human performance or the way a person develops or exercises. So some of the areas within human performance is kinesiology, exercise physiology, which is the effects of exercise on our bodies, biomechanics, which is how our body works. It's engineering of our body. Sports psychology, that is the psychological makeup of how people are effective, or how they can fight through injuries, or how they overcome obstacles. There's a whole bunch of different areas within sports psychology. Sports nutrition, what happens when we eat good food, bad food? How does our body break that food down for exercise? Sport nutrition and sport exercise physiology kind of go hand in hand. Then there's also sport massage. Then on the injury management side of a sports medicine is the practice of medicine, a typical medical doctor. Then we have a physical therapy that specializes in sports. And then there are certified athletic trainers, which I'll talk about more as we go on. So our athletic healthcare team all is focused on taking care of an athlete. They are the primary goal for all of us in the athletic healthcare team. Then we have the coach and the athletic trainer that take care of our athletes. So we're going to talk about each one of these areas in the rest of this lecture. What are the different roles and responsibility for the physician, the coach, and the athletic trainer? We're probably going to go physician, athletic trainer, and coach is the order I'm going. So team physician. So depending on the level of athletics, the higher the level of athletics is, the more team physicians you'll have. For example, on the professional level, you'll have multiple layers of team physicians. Colleges will typically have this too, depending on the level. Like Fresno State will have several different team physicians, whereas a smaller school may have a team physician. High schools typically may have a team physician, but primarily at the high school level, it's the parent, it's the personal team or personal doctor for each athlete. But so the team physician, regardless of the level, oversees all the healthcare needs for that particular, usually university, school, or team itself. So they're the ones who are responsible for the healthcare. They supervise and advise the rest of the athletic healthcare team. So they'll supervise and advise the athlete, the coaches, the athletic trainer, and all the other people underneath that healthcare team. They work with the athletic trainers with injury management. So typically the team physician and the athletic trainer have a really good relationship. The athletic trainer will see an athlete, they have an injury. Typically, they can call the doctor or text the doctor and say, hey, this is what's going on. Then the doctors say, well, have them come in, depending on the relationship with the doctor's office, have them come in and we'll do whatever we need to do with them. That's the response. When somebody becomes the team doctor for a team, especially again at the higher levels, they are saying that I'm going to stop some of my other care for some of the other patients and get these athletes in quicker. They also perform all pre-participation physical exams, and this is true for all levels of athletics. Now, at the high school levels and some of those things, you have to go to your own doctor, but once you get into the college level, typically that is set up by the athletic training staff, that team doctors will come in and perform these pre-participation physical exams. Basically, what we're determining here is the athlete, is the person healthy enough to even perform at the athletic level? Do they have heart issues? Do they have any previous injuries that we need to be worried about, so we can start working on rehab programs for them? So all that stuff is done by the docs. The other thing that docs may do is they may come to practices. They come to games. They may travel with the teams. Again, some of the bigger level schools, especially the university level and the pro level, team docs typically will travel with the team. So they have their own doctors on site when somebody gets injured. So that's some of the response. There's a lot more responsibilities of a team doc than this. These are just some of them. Oh, forgot to mention this one. Obviously, when we see an injury, they are responsible for making the diagnosis. What the diagnosis means is that they say that that's what the injury is, and then they have to make the decision on how we're going to provide care for that particular person. And then they may refer that athlete to a physical therapist, or go get x-rays or get MRI, all the different things that when you see a doctor, that's what they do for an athlete. That's their responsibility. So part of this class is understanding what is a certified athletic trainer, or what are athletic trainers. And so a certified athletic trainer, I'm a certified athletic trainer. I've been a certified athletic trainer since 1996. I took a class like this in 1991. So a certified athletic trainer are allied health professionals. It is an allied health profession. So that would follow like with nursing, physical therapy. That's what that term means. Our responsibility is to prevent the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, or chronic injuries and medical conditions. So we're going to talk about most of these areas within our class. How can we prevent injuries? Sometimes you just can't prevent an injury. The examination is we're going to spend time in our labs with the examination and diagnosis. We're not going to become experts in this class because this is just like the beginning class of athletic training. We'll learn how to provide the proper treatment for injuries, athletic injuries. We're not going to really spend a lot of time in the rehab of injuries in this class. That's not really the focus of this class. We'll learn what the difference between an acute and chronic injuries are in various medical conditions. That's all the different kind of illnesses and stuff like that. So we're going to talk about most of this stuff in our class together. So to become a certified athletic trainer, it requires a master's degree. This is a change that happened recently. It used to be you can earn a bachelor's degree and an accredited athletic training program, but it now requires a master's degree at what's called a professional accredited athletic training program. So in our area, Fresno State has a program like this. University of Pacific has a program like this. So it's a master's degree level. So you have to earn your bachelor's degree. Usually it's like a pre-athletic training or kinesiology degree. That's what you would earn your bachelor's degree. Then you go on and get your master's degree. Once you pass and complete that master's degree, that makes you eligible to take the Board of Certification exam, or the BOC exam. And then you earned a credential, which is a certified athletic trainer, or the ATC, that you'll see after my name, you'll see Jim Ave, comma, PhD. I have a doctorate, and that's what PhD stands for. I have a doctorate of philosophy. And then my credential is ATC, because I'm a certified athletic trainer. And athletic trainers may be employed in many different settings, in, college, university, professional athletics. You can work in a sports medicine clinic or a physical therapy clinic. I have some former students working in the industrial setting, working at local wineries. So they can work in a variety of settings as an athletic trainer. So the responsibilities of athletic trainers it's really our responsibility. We work with athletes from before they get injured all the way to the time they get injury until they get healthy again. That's our responsibility. We provide care for everything. Like I said earlier, all the different steps that we do is to provide the total health care for an athlete. We're responsible for all phases of health care in our athletic training environment. And we're going to talk about more of that as we get going through our class. So the roles of a coach, maybe you're going to be a coach one day. These are your responsibilities on the athletic healthcare team. You're going to plan appropriate activities for your athlete or athletes. You're going to teach them correctly how to do their different activities. So in football, make sure that they know how to tackle correctly, because there is an improper way and a proper way to tackle. That's the responsibility of a coach, to make sure that they don't get hurt. You also need to warn the athletes of any kind of health risk when they're doing their activities. It's your responsibility, along with athletic training staff, to make sure that we provide safe physical environments for our athletes. Make sure that if there's a hole in the ground, that we mark that so somebody doesn't blow out their ankle or knee because there's a hole that somebody didn't know about. And make sure that we have the right equipment that is working appropriately. We don't like to reuse helmets. That's not a good thing to do. Make sure that your helmets are correct, fit correctly for the athlete. Match athletes appropriately. Make sure that you have people that are doing the right activity at the right level. You're not mismatching people, so they're going to get hurt because they're sometimes when you're the only person there, that you don't have an athletic training or athletic trainer or a coach, an athletic trainer or a team doctor around, you have to have some initial understanding of injuries. Should they continue to go, or should you just hold them out, send them to their team doctor if it's just you, send them to a local emergency room? So that's one of the reasons why you're taking this class, is to have some basic understanding of sport first aid. And finally, you are supervising all activities. That's the responsibility of a coach, is to make sure that all your athletes are safe and healthy. And you also are going to provide appropriate emergency care. One of the responsibilities, or one of the things that you're going to do in this class, is to take and pass a CPR class and an AED class, certification. In addition to what you're learning here on the first aid. How do you take care of somebody? Could be a parent of an athlete who has a heart attack. So you have to have that knowledge and be able to take care of somebody if there's an emergency or somebody has a very severe injury, which we'll be talking about throughout our class. 4 areas our athletic healthcare team is prevention. These terms are going to come up over and over and over again. We want to make sure that our number one job is to prevent injuries. We don't want anybody to get hurt. If we can prevent it, we'll do it. Then we have to recognize the injury and then provide the best first aid care on site, on the field, on the court, or wherever we're at. So recognizing it and provide the best care. One way we recognize it is we do an assessment and we provide treatment for that. So the difference between the recognizing and first aid care and assessment is a recognition is just understanding, okay, I have a pretty serious injury and I need to take care of this person. So the second bullet point is more serious injuries, whereas the third bullet point is about injuries that may be aggravating a person longer than a more difficult injury or more serious injury. So assessment is, we'll talk about in our labs, is doing a very methodical injury determination to determine what kind of injury we have and then what kind of treatment. Treatment is the ice, the heat, and those type of things. And then our fourth area is rehabilitation. Again, we're not going to spend time in this class over rehab. And rehab is getting the athlete back to playing as quickly as you possibly can in a healthy and safe manner where they're pain-free with all motion. And they have restored range of motion, restored muscle strength, restored functionability. We're not going to spend that much time in this class talking about rehabilitation. We're going to spend most of our time in recognition and assessment and treatment and care for the athlete.